When facing a pandemic like COVID-19, it's important to follow a protocol of self-checking and tracking to mitigate the spread of the infection. That's why TeleAfya has developed the Pandemic Diagnostic and Contact Tracing System. It's a simple system that healthcare providers and the public can follow to help keep themselves safe and prevent the spread of the disease. The first thing to keep in mind is that everyone is a suspect. If everyone were symptomatic, it would be easy to know who to avoid. The risk of exposure from such persons is high. But the reality is some people in a pandemic may be either asymptomatic or only show mild symptoms easily mistaken for a different malady. And while the risk of exposure is low, it is still wise to engage in safe practices like social distancing and frequent hand washing. Secondly, since we are all suspects, it is important that we all regularly do self-diagnostics on ourselves and those in our care to see if we are showing any signs of being infected by the pandemic. For the coronavirus, for example, do you have a cough? Are you running a fever? Are you experiencing shortness of breath? If not, you and your loved ones do not need disease testing at this time, but still keep conducting self-diagnostic tests. However, if you or someone in your care does show any of these symptoms, you are confirmed suspects. So, you should move to the third step and immediately visit a healthcare provider for a test to see if you or your loved one has the pandemic. This is not only helpful to see if you have the disease or not, your information is added into a database, so medical professionals and health authorities can better track the progress of the pandemic to hopefully better manage it. It is the hope that you do not test positive, but even if the test is negative, you and those in your care must not consider yourselves safe or uninfected. Continue to monitor yourselves for 14 days and continue to practice self-diagnostics. If symptoms continue or get worse, you will likely need to be retested. If the test is positive, you and your loved one must be isolated. This will help prevent others from contracting the disease from you. But also, you should provide the doctors with a list of anyone you or your loved ones may have been in contact with and the places you may have visited over the last several days. This is called contact tracing. This is very important. Anyone who has been exposed to a patient testing positive for the pandemic should be notified so they can self-quarantine by staying home or avoiding crowds, plus wearing a mask and washing their hands to prevent spreading the virus if they have it. They must also consider themselves suspects like hopefully you did and start regular self-diagnostic tests, then take the appropriate actions if they start exhibiting symptoms of the pandemic. As for the positive patient, while in isolation they can get treatments as necessary. In the case of COVID-19, most patients will only experience mild to moderate symptoms and will recover in time. However, the elderly and those with underlying health issues are more likely to experience severe, even life-threatening symptoms, in which case more aggressive treatment may be necessary to help them recover. Protect yourself, your loved ones, and your community by following TeleAfya's Pandemic Diagnostic and Contact Tracing System. Learn more at teleafya.com or on TeleAfya's Facebook page.